Good morning. Welcome to the monthly Governor Mills Opioid Response Summit. The astute among you will have already noticed I am not Gordon Smith, Director of Opioid Response. I'm Jessica Pollard. I direct the Office of Behavioral Health for Maine Department of Health and Human Services. And we oversee the Options Fund and oversee the Options Program. And I'm filling in for Gordon today. So I'll start with just a couple of housekeeping items to make sure we have plenty of time for the speakers, the people you're really here to see. I'll just be brief in letting you know to direct all of your questions to the Q&A section as opposed to the chat. We'll try to answer all of these questions during the presentation. We'll leave a little bit of time for live Q&A at the end if at all possible. But this presentation is being recorded and will be uploaded to the AdCare Summit page. And any questions not answered during today's presentation will be found on the AdCare Summit page in the upcoming weeks. We will have another monthly seminar next on December 3rd from 11:30 to 12:30. That will be a presentation by Jesse Higgins from Northern Light on advancing mental health through telemedicine. So I'm very excited that today's presentation is presenting the first year of the Options program. Options, you may already know, stands for Overdose Prevention through Intensive Outreach, Naloxone, and Safety. This program was first announced by Governor Mills at our second annual Opioid Summit in July of last year. And now we have the first year of data to review from this program. And very importantly, this is an opportunity to hear from Options Liaisons who've been doing work in the field, as well as Chief of Rumford Police Department, about highlighting the work that's been happening on the ground. So the speakers include Sybil, our own Office of Behavioral Health Substance Use Disorder Program Manager, Glen Gordon, who's an Options Liaison for Oxford County, Kate Dowd, an Options Liaison for Waldo County, and Chief Tony Milligan of Rumford. So without further ado, I will hand it off to Sybil.
Thank you so much. And Lorena, can we share a screen of my slides?
Oh yeah, just a sec.
Thank you. So I do want to explain while we're bringing those up that this is not a full year since the Options Liaisons have been on the ground in every county. In October of 2020, after Governor Mills had spoke about the idea of the Options Liaison program, in October, she did launch send out a press release that outlined what this program was going to, what it was going to do and how it was going to look. From there, in November, we had encumbered the contracts with providers that had behavioral health crisis service experience. And then they hit the ground running to recruit, hire, onboard, and place these Options Liaisons so that they can begin their work. In reality, planning for this type of program began over 2 years ago with the intention of receiving funding for a co-responder program that was based off the Portland PD's very successful model. And thank you so much. I appreciate you doing that. And we knew that a rustic was going to look very different from Cumberland County, and Franklin County was going to look very different from Washington County. And that is in terms of treatment, harm reduction, and recovery support landscapes, as well as the local community-based efforts already in place in those areas. Partnership is a major focus of this program. And it has been highlighted across all levels, from the work that is happening between DHHS and Department of Public Safety, down to the partnership of OBH with the providers that were onboarding these individuals, the partnerships that they were making with the host law enforcement agencies, and then the more local and individualized connections and partnerships the liaisons were making themselves within the counties that they were serving. Can you do next slide, please? We were also seeing a lot of SUD related programs across the department, as well as state government, being either newly implemented or newly expanded. and wanted to make sure that the touch points within this program were included and connecting to these other initiatives that were growing and launching. We wanted to ensure that these symbiotic relationships between the role of the liaison and what was happening on the ground in those counties were successful. Next slide. Apart from co-response, what we have asked the liaisons to do is conduct post-overdose follow-ups between 48 and 72 hours after an overdose occurs, or at least attempt outreach. We have asked that they provide continued engagement within the communities that they serve. So individuals that still need support from their liaison, they can reach out. We wanted them to receive ODMAP notifications. ODMAP is a real-time overdose tracking tool that we have been working to implement since 2019. They do cross-position referrals. So for example, if somebody does overdose in Cumberland County, but actually lives in Sagadahoc, Tom, our liaison in Cumberland, can link to Mariah in Sagadahoc and have her continue to support that individual in the county that they live in. We included a Maine Mom connection. So the Office of Maine Care Services did launch the maternal opioid misuse integrated care model. And so we wanted to make sure that pregnant and postpartum women were referred to that very important OMS program. We asked that they do data tracking, which is very important because that is what is informing this presentation today. Naloxone distribution is a relief for those that are affected others and need to have that life-saving medication on hand for the individuals that they care about that are struggling with SUD. We ask that they provide community anti-stigma education, as well as education around what the options program is, what they do, and what SUD treatment models we have. And so that has been very successful. As you'll see, they've been able to reach over 1,200 individuals for trainings. Medicaid expansion was one of the first executive orders that was implemented by the governor's office. And we wanted to help assist individuals to fill out those Maine Care applications. We know any sort of paperwork that comes with healthcare can be burdensome. And when you're struggling with a substance use disorder, we wanted to remove that barrier for consistent insurance coverage. Connection to an FQHC or other provider for HIV or HEP testing, and other harm reduction supports that are available in the communities that they serve. We also have asked that they help identify social needs of individuals and help get them information about housing, food services in their counties, and other type supports. Next slide. So for the month of September alone, what we saw were 36 calls co-responded to. And by co-response, we mean showing up to SUD-related emergency along with first responders, but separately from, so that they can stay for longer as EMS and law enforcement clear to provide support to that individual if they consent or they need it. We saw 92 post-overdose follow-ups conducted, 264 naloxone kits provided out in the communities, 65 proactive referrals received. This is really important, proactive, to make the distinction between proactive referral and self-referral. Proactive is when it comes from a treatment provider, law enforcement agency, EMS, et cetera, for individuals that maybe haven't overdosed yet, but are struggling with substance use. And then we also have 47 self-referrals, so individuals reaching out to the liaisons on their own behalf and requesting assistance. We saw 30 training sessions were completed with 402 individuals reached, 49 referrals to treatment, 40 connections to recovery supports, 23 connections to our syringe service programs, and 12 20 referrals for infectious disease testing, and 5 pregnant and postpartum individuals were referred to the Maine Mom program. Next slide. So once we had a design for this, we had to approach 5 agencies that did have the behavioral health crisis service provision experience. And we completely appreciate the belief that they had in the project that we proposed, recognizing how challenging it is right now to find and hire certified or licensed healthcare workers across the healthcare spectrum. So we appreciate the efforts that you put into place, as well as the police departments that have signed on to host these liaisons. They had a lot of faith in our ability to get this implemented and for it to be a benefit to them and the other law enforcement agencies in their county. So we appreciate that. And who are the liaisons? This is your list. We have Dave, who was really the first liaison to start and has done a fantastic job of developing relationships with law enforcement officers across his county and is beating feet on the co-response. So we appreciate that, Dave. Haley, who works up in Aristic, she has one of the things that I find very exciting about the work that she's done is the connection she's made with the Micmac's Public Health Agency in order to better serve individuals that live in that community. Tom, who was great and did a lot of outreach within the South Portland Hotel that was under contract to provide temporary housing to the unstably housed population in that area. Rebecca, who works in Franklin County, she was able to identify an individual with Maine's Department of Environmental Protection that could provide personal syringe disposal boxes and was able to share that with the rest of the liaison. So that was really helpful information. Hancock, we have Emily. She just started and we're very excited to see her start her outreach and connections with the law enforcement and EMS providers in the Hancock County area. So welcome to the team, Emily. In Kennebec, we have Dawn. Dawn is our resident tent lady, and this is because she was able to connect with a nonprofit that provided her with tents that she distributed to the unstably housed individuals in Augusta and Waterville, and has been dubbed as the tent lady. We also have in Knox, William. William is new to the team as well. And we do look forward. I know that Knox has some really robust recovery programs at work. So we look forward to seeing how he dovetails his work and coordinates his work with the stuff that's already happening there in Knox County. Sherry, she's been fantastic. She's been doing a lot of work in the correctional facility in her county and helping individuals transition and providing supports as they re-enter their communities, which we know that is a particularly vulnerable population. And then we have Glenn, who I will let speak for himself later on. He is fantastic and he really has a lot of enthusiasm for the position. So we appreciate the work that he's been doing. Adam works in Penobscot. He has a whole team around him that helps assist with post-overdose responses and distribution of naloxone, which is overseen by Bangor Public Health. So we really appreciate that partnership that has been created in the Bangor and outside of the Bangor area. We have Ashley, who is new to Piscataquis County, relatively speaking, and is working diligently to navigate and interface with the law enforcement agencies that are located in her county. Mariah has weekly meetings with her local MDEA agents and actually did a training for Maine's Fishermen's Association and is currently working to try to access BIW staff so that she can talk about the services and supports that she can offer to staff that work at Bath Iron Works. Karen has been doing a lot of community outreach partnering with Kennebec Behavioral Health as well, and some of the programming that's going on at Reddington Fairview. So we appreciate her efforts. Kate is on, and so I'm going to let her talk about the work that she's been doing and the partnerships that she's made with some AmeriCorps programming that has happened in Waldo County. Robin Stanwood, who has been double dutying in Washington County with work in the county jail, as well as providing options liaison services. And Alyssa in York, again, we appreciate the double duty that you are pulling as a clinical supervisor, but also really taking on the York County responsibilities as well. Next slide. This is just a quick snapshot of some of the key activities that the liaisons do. One of the things that I do want to make sure that you guys keep in mind is that the numbers are not, they represent individuals. They represent individuals with complexities and diverse problems that they're working to navigate through as they're dealing with their substance use disorder. Next slide. So if you take a look, this provides a really great timeline of the buildup of options liaisons. So this really tracks or breaks down the referrals to treatment, recovery, harm reduction, and main mom services. And by March, I believe we had 10 to 11 liaisons. So as this grew, obviously the referrals that they were providing grew. Next slide. So apart from treatment and recovery, we had 118 individuals referred to the syringe service programs, 86 individuals referred for STD testing in total, 38 individuals assisted to complete their main care applications, and 9 individuals referred to the main mom program. Next slide. This demonstrates the community distribution and the growth of that for naloxone. We do appreciate the work that UMaine has been doing as well to partner with this, as well as our overdose prevention partners for supplying the naloxone kits to the liaisons. Next slide. So the trainings conducted, we do have overdose education sessions that happen, as well as they talk about the options program. And they have provided anti-stigma. This is trainings to law enforcement. So we've seen over 1,200 individuals reach with their trainings. Next slide. Here we see the breakdown between co-response and post-overdose follow-ups. Next slide. And sorry if I'm talking fast, but I know other people need to talk. And this is referral type to the liaisons. One, this really speaks to the relationship building that they have done to be able to receive proactive referrals from local public safety or treatment providers. And then the trust that they have built within for individuals to reach out and refer themselves. Next slide. And as you can see over time, most everything is trending upward other than co-response. And this could potentially be because a lot of emergency services have really been bogged down with some of the Delta and COVID cases that have spiked. Next slide. This, I think, is really important to talk about. After initial contact, we did ask if they were able to re-engage with the individual. And it's nice to see that they were able to make follow-up contact versus not being able to make follow-up contact. Next slide. And of the individuals that they did refer to treatment, they were able to, 91% of those individuals did engage with that treatment provider. We don't ask them to track longevity of treatment engagement, but we do ask to find out whether or not the individuals did follow up with that provider. Next slide. We also ask, because health equity is important to the department, we also ask them to track some demographic information. So it is exciting to see that 39% of their engagement within their communities involve individuals that identify as other than white. And then next slide. And here we see that we did ask if individuals were comfortable that they identify their LGBTQ status. And we see that 45 individuals that they've engaged with are have identified as demonstrated. And then the next slide. I did want to give you an opportunity to sign up for the text spike alert initiative that we launched this summer. If you just hold your phone up over that QR code and then text spike to the text message that pops up on your phone, you are able to sign up for your county. And then while I give you a minute to do that, I would also like to say that I am very appreciative of the work that the technical assistance team has done, driven by MMA's CQI unit and supported by former pioneers of the Portland Police Department's Behavioral Health unit. And through monthly individual coaching calls, monthly TA calls, and assisting liaisons to work through local challenges and barriers, their efforts have truly made this a team approach and allows the liaisons to share and learn from one another. So at this point, I will stop talking. And then I will turn it over to Kate Dowd to talk about the work that she's doing on the ground in Waldo.
Thanks, Sybil. So my name is Kate Dowd, and I'm the options clinician for Waldo County, based out of beautiful Belfast, Maine. I've been with options since May of this year and have really enjoyed the process of establishing this role in Waldo. Waldo is a place I've been calling home for the past 10 years. So at this point, I don't know that there are many of us on this call who are not personally impacted by addiction in some way. And for me, this is true also. This work is absolutely personal. Both my parents are still living, but when I was 5 years old, I lost a parent to the world of active addiction, and I never got him back. So the conversation about choice was very prevalent when it comes to using substances in my house. And it never made any sense to me. I knew the person my dad had been, I knew the person he could be, and I knew he didn't choose to give up that life, but that was the narrative of the time and what I grew up hearing and what I'm sure many of you grew up hearing. So I know the impact of addiction on the whole family beyond just missing someone, which is significant in itself. But there's the financial piece, the housing, the childcare, the legal involvement, unpredictability, and that fear that something worse is going to happen than what's already happened. So if I am being truthful, I had intended to stay far away from addiction and substance use when choosing a career. I worked in preschools for many years and with adolescents in mental health treatment. And somewhere along the way, I met my now fiance, who was a few years into recovery. And I got to see what life can look like for someone with addiction who was surrounded with love and support and people who didn't give up on him when treatment didn't work the first time or second or third, someone who has been saved by Narcan. So as we're getting ready to celebrate his 11 years in recovery next month, I really have a lot of hope that recovery is possible for anyone, and we can't give up on people ever. So that's a big part of what led me to this line of work. And when I first saw the job listing for options, the combination of collaborating with first responders, community members, working with people directly, offering different pathways to recovery, I couldn't believe that this existed in Maine in my community. So I was like, this is exactly what I want to be doing. And I'm really glad that I decided to. So I'm partnered with the Waldo County Sheriff's Office, which is an agency that I really can't say enough nice things about. Everyone there is incredibly supportive of options and really doing what's best for our community in general, trying to get people the help and the support that they need. And I feel that I am especially fortunate to be embedded here as the Waldo County Options Liaison, because prior to the implementation of options, the Sheriff's Department had partnered with Volunteers of America and implemented a community liaison position. So mental health, substance use counselor to co-respond to 911 calls or conflicts that weren't solely law enforcement, and that was filled by Rob Porter. VOA has since expanded to add another liaison, Rochelle Bell, and they've been good enough to let me join their team, with my focus there being on overdose prevention and substance use. So special thanks to the leadership in that department, Chief Deputy Jason Trundy and Sergeant Nick Ottinger and Robin Goff from VOA for all their efforts to launch and organize that community liaison program and for including options with it. And there are a lot of reasons that I think this position is so valuable. One of them, as Sybil highlighted, is that as options liaisons, we're able to respond in all sorts of different ways and the ways that make the most sense for the community that we're in and the law enforcement agency we're partnered with. Because as you'll hear from Glen, what works for him in Oxford might not work for us in Waldo. We're in really different systems, partnered with different agencies, with different resources available. So that means the day-to-day experience for each of us is really unique to where we're located. And while I'm pretty sure that most of the liaisons would say there's not a typical day in this role, like I'm part of a co-responding team, so co-responding is a smaller piece of what I do in Waldo. But no matter what I'm doing day to day, whether it's working with someone directly, distributing Narcan, doing a training, talking to providers or parents and family members, I really think the emphasis needs to be on building relationships, connecting with people, meeting with people where they're at. That's going to give everybody the greatest chance of success rather than me or any of us having an idea about what's best for other people. I once heard someone say the right level of care is the one that someone's willing to start with. And I think about that often because I know it can be hard to get on board with medication assisted treatment or needle exchanges, but those are huge steps towards living safer and healthier lives. And it's not for me to determine what the right solution is. And the help people want or need often isn't what we expect. So the other liaisons will say this as well. We're often addressing those basic needs like shelter, food insecurity, transportation is huge. We're talking about that stuff before we're even thinking about recovery. So you just keep showing up for people, just keep meeting people where they're at. And I'll say that's where those relationships come in again, because I also mean community relationships. One options event that I thought was really successful recently came through a collaboration with Islesboro Public Safety and some really amazing community organizers on the island. We set up in the fire station, we put up flyers, we said, come learn about different options for recovery. We will have Narcan and cookies. And we had no idea how many people, if anyone, would show up. But we filled the chairs and had a standing room because I think that people really want to show up for their community and they don't always know how to or what that first step is. And it takes a village, right? So this community, Islesboro, has decided to continue those conversations, and I'm lucky enough to get to take the ferry out to Islesboro once a month to be a part of that with them. So from here, I'm going to pass it to Glen, but I just wanted to end with saying that although I've left the idea and that narrative that substance use has anything to do or addiction has anything to do with choice, I think that choice really finds its place in recovery. And if there's anyone on this meeting who I haven't found yet, who's in Waldo, near Waldo, working in Waldo, please reach out. I'm happy to connect with anyone and happy to answer any questions that come in.
All right. Hi, everybody. Thank you, Kate. And thanks, Sybil, for asking me to be here today. My name is Glen Gordon. I'm from Oxford County Mental Health Services. I'm the Options Liaison for Oxford County. And I'm actually going to ask Chief Milligan to come back on right now to speak a little bit about the initial, the law enforcement involvement with the Options program in Oxford County. We couldn't do this. I couldn't do this without the help of the Rumford Police Department and Chief Milligan. And so I'm going to let him say a few words before I jump in. Chief?
Thanks, Glenn, and good morning, everybody. I'm Tony Milligan, Chief of Police here at Rumford. I have 33 years of law enforcement experience here in Maine. Most of that was with the Maine Drug Enforcement Agency. I was a special agent assigned to the Western District of Maine, spent 28 years there, and came back to Rumford in January of 2020 to assume the role here as Chief of Police. When I was approached a little over a year ago, who now is a good friend of mine, Ashley Brooks from Oxford County Mental Health, who we have an excellent partnership with to take on the challenges of mental health cases here, specifically in Rumford. She came up to me with this crazy idea of this options program, and I really didn't know what she was talking about. I had read something about it and wasn't really sure what it all meant and really how it was going to benefit the folks here in Rumford and how it was going to benefit my department. For the chiefs and sheriffs that may be on this webinar today, I probably had the similar reaction. If you're not connected to options today, you probably are thinking the same thing that I was thinking, that this is just one more thing to put on our plate that we just don't have the time or resources to handle or manage. We're asking our patrol officers to do too much out there as it is, and we're responding to all of the social problems that the world has to offer. We're the default go-to because the resources out there are limited. And I just couldn't get my mind wrapped around what options, how options was going to help us. But having faith in Ashley, I attended some meetings and listened to the explanation, and my hesitation was quickly resolved after kind of realizing what this can do for me. In a nutshell, this was a way to divert all of the calls that we're getting, responding to with respect to overdoses and substance use disorders. Now we have a go-to resource to manage all that for us. Our biggest challenges that we're seeing in our area, I think the number one biggest challenge was transportation. We had somebody that would show up at our lobby or we would encounter on the street that said that they were suffering from substance use disorder and was ready for some help. Now what do we do? And it always seemed to, one of the biggest hurdles or obstacles to overcome was, how do we get them to where they need to go? And where is that place? What facility will take them? What facility has a bed space available? Do we have money or insurance to cover any costs that may be associated with any kind of recovery? And then who's going to coordinate all of this and be the case manager? Who's going to be the designated person to pay attention to this case and any other cases that may be coming up? That was a huge challenge. We have a 15 officer team here for a population of under 6,000 people that we provide 24-hour coverage. And I have 2 officers on the street at any given time handling calls. And to get bogged down with an overdose case or someone who wants or needs some help, we want to help, but there's only so much we can do and only so much time we have to dedicate to that. And to take one officer off the street to try to mitigate that was a big problem for us. So once I learned what options was about, and we got together and got discovered Glen as our area clinician, things just started falling into place so rapidly. I was asked to help kind of bridge that gap between the options program and the local law enforcement agencies here in Oxford County to kind of maybe dispel any rumors or concerns that I had, that the other chiefs or sheriffs may have. And I think those were well received. it just started to make sense. You know, our officers are getting freed up more quickly so they can handle the wide variety of social problems that they're required to tend to. And now, again, with Glen, we have a designated go-to person to manage all of these cases and address all the challenges that we once had that now he has agreed to take on. You know, what else can we do with this program to make it better? We kind of looked at it, you know, in 2020, last year, just in Oxford County alone, we had 15 reported overdose deaths. And in 2021, through July of this year, we've already had 15 overdose deaths. So Glenn and I and the other stakeholders kind of talked about, is there anything else we can do that may be better? You know, as opposed to kind of waiting for the overdose to happen. And we thought about maybe reaching out to those that either we know are suffering from substance use disorder that we encounter on our day-to-day calls, or that we may learn about from family or loved ones. And we decided that, you know, it wouldn't hurt to maybe, if there is a way to have like a portal, an online piece, so that somebody could go on and either self-refer to the options program, or if they have a loved one that they're, you know, concerned about, whether that person's ready for help or not, you know, submit that information. And so we thought of a very cheap, actually it was free and expensive way to make that happen. We created a Google form and threw that up on our website and on Facebook as a direct link and a means for people to do that. And we decided to do the same thing for law enforcement. You know, one thing we realized pretty quickly, law enforcement is pretty busy and they're pretty maxed out on what they have to do, all the responsibilities they have. So I had mentioned to Glenn that in order for the law enforcement piece to work, you really have to make this simple and easy. And we thought, you know, we created this form to go online. Any law enforcement officer in Oxford County, or anywhere for that matter, it's not really restricted, could go online, just answer a few questions, contact information on the person that may need that services. And as soon as that officer or someone from the public hits the submit button, that information goes directly to Glenn at the options program, and he takes it from there with as far as any follow-up contact outreach. And that seems to have really worked well for us. From March of this year until the end of October, we've had 104 referrals. 34 of those were from the public and 70 of those were from law enforcement. That's something that we probably wouldn't have had or seen if we didn't put that up. So that's just one small example of something that we can do to help supplement the options program. But I can't speak highly enough of Glenn and the program. I was hesitant because I thought this was going to need more work and tying our people up. And in fact, it's been exactly the opposite of that. With very little heavy lifting on our part, we've been able to divert a lot of these calls or these instances right over to Glenn in the options program. And he's been very successful in, there's a lot of success stories. And I won't take any of that thunder away from him because he really deserves all that credit. So there you go, Glenn. I'll hand that off to you. And I'm very proud that Rumford PD is a partner agency here in Oxford County for the options program.
And I'm so grateful for you guys. You know, I know really the basis for our relationship is food. I used to make these guys sandwiches and cookies and muffins and you know, there's nothing that police love better than some good food. So I was lucky to have that as the start of my relationship going into the options program. So yeah, my name is Glen Gordon. I'm the options liaison for Oxford County, working through Oxford County Mental Health Services. And yeah, just hopefully I don't, you know, people, I've been accused of being enthusiastic and passionate about this job and my role. And certainly I love this program. And so I wanted just to talk a little bit about my experience in the last year with options, what I learned, what the solution turned out to be. It was different than what I initially envisioned. and kind of what success looks like to me for the options program. So at the beginning, so define the problem. What the problem was, nobody looks at a problem until there's a crisis. So we're faced with a crisis. We're faced with an increasing number of fatal overdoses. And so it's calling everybody's attention to substance use disorder in Maine. But we're not looking at substance use disorder, has always been there, but until we started to see increasing numbers of fatal overdoses, and this is always how people look at substance use, is when a crisis precipitates action, or precipitates at least awareness. So coming into this, I thought, well, the problem is obvious. Stop using drugs. Stop drinking. That's it. It's a simplification of the problem. When I worked years ago doing some volunteer work in the field of alcohol abuse, we used to get calls in the middle of the night. We'd go and pick somebody up, and we'd have a 6-pack of Budweiser in the back of our car, give them a couple beers and take them to the Arnie Hansen Center down in Portland and drop them off. And that was it. That was the 1980s version of the options program. Maybe they'd leave the Arnie Hansen Center and go to Mercy Hospital. Maybe they'd leave the Arnie Hansen Center and get another 6-pack of Budweiser. But that was our version back in the 80s, the options program. So we've come a long way since then. But still, I had this oversimplification of substance use and responding to substance use disorder. I thought, well, this is a simple path. Stop using. The path's simple. Sell them the idea. You need to get sober. You need to get clean. Take them to detox. Take them to inpatient treatment. Sustain abstinence through 12-step programs, outpatient counseling, peer recovery coaching, whatever it was. Bingo, bango, bongo, a nice, neat package. I thought it was an individual problem. It was really a problem of that particular person. And that's kind of the attitude, the outlook I had getting into this. And even as much as I've been around it all my life, I still had a really fixed, simple idea of it. And on some level, I still thought, even with all my experience in thinking of it as a disease and what have you, I still had some piece of it that it's a choice, that there's some act of the will that the individual needs to take to get help. And so over the past 12 months, I've had to look at everything I thought about substance use and substance use treatment and admit that I really was not nearly as smart as I thought I was. So I think Kate talked a lot about it, Sybil talked a lot about it, but just the complexities of substance use disorder, and the fact that it really is not at all an individual problem. It's a public health problem and a social problem, and it really requires public health and social answers. So a few of the things, getting off to the ground, this is psychology 101, Maslow's hierarchy. We got so many people with substance use disorder that don't have basic security. The basic needs are not met: food, shelter, clothing. It's hard to gain any traction with substance use when you don't have a place to live, you don't have food to eat, you have crappy clothes, you can't take a shower. It's tough. It's a tough sell. Well, why don't you try getting sober? Maybe you can change this. That's a tough sell. Stigma is huge. People are so ashamed and so embarrassed, and they're doing things they don't want to do. They're making bad choices. The behavior is bad because they can't control their need or desire to take a substance. So they're making all kinds of bad choices, and it keeps piling on. It just piles on and piles on. Adverse childhood experiences and trauma. Everybody I talk to, I swear to God, everybody I talk to, anybody who engages with me, at some point it comes up. Adverse childhood experiences and trauma. I was taking a guy for a ride to Lewiston, and we were talking. It was relaxed. We're having a nice conversation. All of a sudden, he just goes, when I was 3 years old, my parents sold me for child porn so they could get money to take drugs. I just was like, what do I say to that? I don't know what to say to that. I was shocked. I wasn't ready to hear that. We're just having a normal conversation driving down the street. So these things are occurring. People are growing up to deal with this stuff. They don't know how to deal with this stuff. They're looking for a solution. So we think substance use is the problem. They think substance use is the solution. Childhood trauma is the problem. 2/3 of IV drug users have 4 or more adverse childhood experiences, or what we're calling ACEs. And if you're not familiar with that, I can't really get into it here, but look it up on the internet. There's plenty of information about it. Mental health, I encountered a lot of mental health that I didn't anticipate, and some of these people were taking medication and drugs because they didn't have access to regular health care. And so they're hearing voices, they can't focus, they can't concentrate, and they're taking these drugs off the street, and it's making life better for them at first. So they're trying to self-medicate. They're trying to be their own physicians to deal with their mental health issues. We got issues of poverty, family history, family substance use. early on, I picked up 2 people, I had 2 referrals, and we're just talking about their substance use, talking about their families. Both of them had Narcan their mother in the last month. They were providing Narcan for their mother who OD'd in front of them. So, I mean, this is, these are the things that I'm experiencing and witnessing out there. Environment, housing conditions, drug trafficking in the neighborhoods. I talked to one guy, I took him to treatment, and I'm like going, what are we going to do? I'm thinking to myself, what are we going to do when you get home? Your whole family are drug. He doesn't know one single person who doesn't use drugs. He lives right in the middle of Mexico, which is right in the middle of a huge drug neighborhood where every other apartment on the block, it's really challenged. They are using or selling drugs. Isolation and loneliness. I came into a contact with a guy, and I couldn't. He couldn't seem to keep paying his cell phone bill, or keep a cell phone, or break a cell phone, lose a cell phone, get mad, smash it, whatever it was. And I just having a hard time keeping in contact with him. I finally said, contact me on Facebook Messenger. I said, he had access to the internet. And so one Saturday, he's just texting me, messing me up. And I'm like I'm getting a little bit annoyed. I'm trying to rake my yard, mow the lawn, all this kind of stuff. And I'm like, I'm busy. This is an urgent emergency to me, but I'm responding to him periodically. At the end of the day, about 5 o'clock in the afternoon, after probably 10 or 15 exchanges over the course of the day, and I'm trying to be patient and understanding because I know he's suffering. He finally says, thank you, buddy. And I went, oh my God, it should have been so obvious to me. He's isolated, he's lonely, he has a chronic brain problem, which is one of the reasons he got into substance use in the first place. And being so bored and isolated and lonely, it's all he can think about is his pain. Crisis, suicidality, criminality, all these things. A couple times in the first couple months of getting started, I was called for a mobile response team to somebody who would call the crisis hotline. I went with the Rumford PD and the Norway PD to somebody who was threatening to commit suicide because they were under the influence of drugs and alcohol. Employment, underemployment, lack of skills. A lot of, there's an economy that happens in this area. I'm sure it's typical of everywhere. There's an economy of people who are underemployed or in poverty, of favors and sex that just, instead of cash money, these are the things that make the world go round. And as Kate said, transportation, as Chief Milligan said, lack of transportation is access. So all these things really make substance use really complex. And I realized that the problem wasn't substance use itself. The problem was people are overwhelmed. And the problem is that people who are in it are feeling hopeless. They feel hopeless. They can't think of, what do I have to live for? They can't find purpose, and so that, to me, ended up really being totally eye-opening. It made me think about my whole response to this in a different way. And so what's the solution? Is Options provides a platform, a framework for solving so many more of these problems. And, and the basis of it is really the relationships with the people who are referred to us, the relationships with law enforcement, the relationships with community agencies, social services, all these things, and it takes time to build these relationships. I still feel like I'm learning about new people and new resources in the community every single day. I've been at this since last November. And it's still I feel like I've just touched the tip of the iceberg. So anyway, I jumped into this with a lot of really solution-based. Let's go, get you to treatment, get you to inpatient, get you to IOP, whatever it was, and Oliver Bradine, who is one of our consultants for the program, he said, it's easy to focus on solutions, but we really need to focus on relationships. And I found that as I took that to heart and started to slow down, I started to have better impact with people. I needed to slow down. I needed to listen. I need to understand the depth of the problems. I need to get to, let's deal with, first things first. And to take time to build relationships, and not to expect my first contact with a person to end up in them going to treatment and getting sober, getting clean, putting down the drugs, putting down the needle, whatever it was, it's really a time-oriented, relationship-based process. So the great thing about Options is, like Kay was talking about, we get to meet people where they're at. I meet people in crisis. I'm rolling with the local police, and going to their house. One woman I have has a chronic alcohol and drug problem, and has been homeless for a long time. And I go and sit with her under the bridge. I was watching Ernie and Joe, Crisis Cops, and they were talking to somebody on the bridge who was getting ready to jump off the bridge. And in this vignette, the cop, Ernie, he sits down on the sidewalk on the ground, and he just starts talking to her. I was like, that's it. It's not just a matter of visiting where they're at. It's like sitting, it's sitting with them. I went and sat under the bridge and sang songs with this woman. I'm gonna refer to all the people now as either Fred or Wilma, so as in protection of their anonymity. So Wilma, I'm sitting with her under the bridge, and we're singing songs, and we're talking about her family, and just trying to make that connection. It was so important, so important. When she gets in trouble, she asks for me. When she gets in, because she shows up in the hospital, she shows up with law enforcement, she shows up in other agencies to go, I need to talk to Glenn. She's asking for me. We've made that connection. And I hope long-term that it will be a connection that is short-term, it gives her some relief to have somebody to talk to. I hope we'll make some more progress going on. Anyway, so yeah, moving right along. So it's really a community effort. I can't say enough about the relationship with the Rumford PD, and glad you were able to make relationships and inroads with all the law enforcement agencies in Oxford County. We've made a great connection with the Western Maine Alliance, Western Maine Addiction Recovery Initiative, a great relationship with the Larry Labonte Recovery Center. And so we're all working together. We're all thinking about this. Options is not one person for your county, but it's somebody who can kind of like learn the work to kind of collaborate and grow this thing. I work with a lot of the churches. Churches have been so crucial in just providing financial resources sometimes for getting somebody to sober living. So the solution to me is really about this building relationships, building this collaboration between all the resources and the people that exist that care about people who have substance use disorder, that care about their family and their friends who have substance use disorder, that are trying to get some help for themselves as friends and family members of people with substance use disorder. And as Kate said as well too, it's I always think, a biblical reference, God says, don't forget, we always operate in a human resources, a 3 strikes you're out policy. 1, 2, 3, we're done with you. Biblically, they say, how many times do you forgive your brother? 70 times 7. So I always have taken that math. I think it's better math when you're dealing with substance use. How many times do I help my brother? 70 times 70. 70 times 7. What is that? 490 times. So if it's 490 times and you want help, I'm here. On no judgment, it's the same as the first time. Doesn't matter. So I'll tell you a quick story, and I'm gonna roll out of here. So what this looks like, what a win looks like, what this collaboration looks like. So I get a call from Sergeant Jamie Bernard from the Rumford Police Department. He's got a young woman who is trying to kick meth. And she's been off meth for about 2 or 3 days, and all of a sudden she's having all these symptoms, and the symptoms are clearly opiate withdrawal symptoms. She says I've never done opiates in my life, but she had been getting crystal meth that was cut with fentanyl. So I contact the emergency room at Rumford Hospital and get a hold of the emergency room physician, Dr. Barris up there, and I said, this is the situation. This is what I think is going on. Do you have time? What's going on in the emergency room right now? And I take her up there and I sit with her, and they send in a doctor, an intern, a nurse practitioner, another nurse, and they all talk to her, and they're all calm, and they're all talking to her really respectfully, and they're trying to check out her discomfort and all this kind of stuff. And it's really good. We're there for probably 2 or 3 hours. She gets some medication to make her a little more comfortable, and she goes home, and we stay in touch with her over the next couple of days. I get her in touch with Kari Taylor, who is a recovery coach for Project Save Me through the WMARI, through the Western Maine. And so Kari starts to make a connection with her, and she starts talking about resources. What would you like to do? What do you think would work for you? And Kari makes a connection with recovery residents in Portland. WMARI puts up some money for a scholarship. I get her connected with some 12-step resources in our area in Mexico, Rumford, and help her to meet a sponsor. She needs a sponsor to go to this particular program. And she attends meetings until she goes to that program for about 10 days in the area and heads down to Portland. So all of this working together, Rumford Police Department, the Larry Labonte Recovery Center, Western Maine Addiction Reliance Initiative, Kari is a recovery coach for Project Save, the Options Program, the Rumford PD, all this stuff. So this is changing this woman's life. So this is how this Options can work and does work. So with that, I'll close up at success. What I thought it looked like was not throwing somebody a couple Budweisers and take them to the Arnie Hansen Center. I like that simple method, but it's not the effective method, and it's not a method for my success today. So first of all, what does it look like? Success, harm reduction. I am a big advocate of harm reduction. I was not when I started. I wasn't really sure. I was on the fence about it, but at the very least, let's keep them alive, keep people out of jail. Let's prevent overdose, reduce risk, keep them alive for their friends and family. These are lives worth saving. And if we can stabilize or improve their health, you know, that's the first win. Next one is incremental gains in any recovery related domains. You know, housing. You know, I had somebody who was chronically homeless since 2013. After working with her for 2 or 3 months, we were able to get her into an apartment, and she stayed in an apartment since. Not always sober, still has struggled with some relapse and some mental health issues, but she is getting help and is in contact, and we maintain contact and maintain trying to get her out. So incremental gains, connection and reducing stigma, you know, letting people know they're not alone, giving them people they can connect with, not feel judged by. Recovery, incremental gains in recovery domains and a desire to recover, a restoration of self-image and efficacy. And for some people, it is abstinence. And wrap up really quick saying, you know, this is OxyContin hit the market, the sales market in 1996. It's 25 years later. So we're dealing with the repercussions of this over 25 years later. It's not a quick walk out of the woods. It's going to be a little bit of a walk out of the woods yet. But this is the right solution to get it going because it's dynamic, it's collaborative, and we're dealing with a public health problem, but we're also meeting the needs of individuals where they're at. Thank you very much for your time. I just one thing, you know, resources sometimes are a challenge. Barriers are sometimes a challenge. That's our job as options liaison, to break down those barriers and resources. So I just think of this thing from Arthur Ashe. He said, start where you are, use what you have, do what you can. And that's what we're doing today. Thank you very much.
Thank you so much, Glenn, and all the presenters. You're getting lots of virtual claps and standing ovations. And Sybil, you wanted to answer one of the questions live that came in on the Q&A, and we'll also take other questions in the last minute or two.
Yes, so the spike alerts are designated as sort of a 3 overdoses recorded into ODMAP within a 24-hour period. We do send a lot out for Cumberland County, York County, Penobscot. We just sent one out this morning for Androscoggin. But yes, Chastity, you can get set up to receive the ODMAP spike alerts yourself. And you can email me. I'll put my email in the chat and I can help you get connected for that.
Let's see, another question is, looks like, is options available to minors is a question in the Q&A.
So Glenn can answer that because he has actually gone into schools.
I got a call from RSU 56, and they had some kids that had some they needed an intervention with, and so we have been working with the Larry Labonte Recovery Center. I've been going in and basically doing kind of a screening assessment, and then working with recovery coaches from the Larry Labonte Recovery Center to connect them with these kids and meeting with them once a week, right at the high school and actually the middle school in Dixfield.
Well, we are out of time. Thank you again to the fantastic presenters and for all of you for attending and asking your questions and giving your feedback. We are happy for this program to continue. And we'll see you next month up for the next summit webinar.